That news of more positive results from COVID-19 vaccine trials helping bring a little hope to people exhausted with the pandemic and concerned about their own health.
And so we're lucky enough to be joined by Dr. Jeff Pothof, UW Health Chief Quality Officer, live with us this morning. And Dr. Pothof, certainly appreciate your time. It timed out well. We're getting this information from Moderna about 94.5% effectiveness. What does that kind of number say to you, and what is your reaction to the news?
Yeah, in a time where it's hard to come by good news, these news from the vaccine manufacturers is really welcome. Vaccines that are this effective really put them amongst the best that science has created. And it really does give us hope that there's a light at the end of the tunnel.
We're talking with Dr. Jeff Pothof of UW Health. Doctor, that said, how long is that tunnel? I mean, these vaccines aren't even out publicly yet. You have to think frontline healthcare workers are first in line. How soon till we begin to see any sort of notable impact from any of these vaccines being distributed?
Yeah, I think you'll start hearing reports of vaccine being administered probably sometime early next year. Like you said, that will be prioritized towards healthcare workers, people who are at greater risk of severe disease. But probably April, May, June, somewhere in that time period, these should be widely available. There'll be regional variation to that, but that would be my best guess for when we'll have vaccine widely available here in the United States.
And so in the meantime, healthcare professionals like yourself asking people to just hunker down because there is that light at the end of the tunnel, and it's important to stay home and wear masks. We're coming up on Thanksgiving. What are you telling families right now as they're just trying to figure out, is there a way that we can have a Thanksgiving with family members who live in other cities, live down the street, that type of thing?
Yeah, the only way to have Thanksgiving with your family, with loved ones, is to do it virtually this year. We'd hate to be the bearer of bad news, but at this point, even small gatherings, less than 10 people, pose enough risk where we don't recommend it. So this year, unfortunately, Thanksgiving has to look very, very different. Hopeful with the vaccine news on the horizon that people are able to buckle down here for just a little bit longer so that we can make an impact on this disease.
Talking with Dr. Jeff Pothof of UW Health. Doctor, one more question, just a curiosity. What do you make of the widely varied outcomes that we're seeing in people? I'd read somewhere in the neighborhood of 40% of people who have COVID are asymptomatic. You keep hearing about people who are surprised to find out they got it, felt nothing. And then I've got friends, middle-aged people, otherwise healthy, they're in bed for a week or more and battling. How come people are having such varied results?
Yeah, I wish we knew more about this. We do know that, it's not the virus itself per se, but our immune systems that kind of determine how aggressively we respond to it. Those with a much more aggressive response tend to do worse. But I think this is, the thing that's so concerning about the virus is there really is no way that you can predict what's going to happen if you get COVID-19. So we all need to be really careful because we might get off easy, or we might end up in an ICU fighting for our life.
Dr. Jeff Pothof with UW Health. Dr. Pothof, thanks so much for your help this morning.
You bet. Have a good day.
You too.